welcome everybody. Thank you for joining us. We are now giving a welcome to Hong Kong Youth Space, Open Space. Today we're very delighted to be able to have a guest speaker who's going to be speaking on a really important topic that would be of interest to most people. He'll be talking on Together for Wellness, Food, Care and Teamwork in Stroke and Dementia Support. I think all of you will probably have some family members or know of people who may have experienced conditions such as this and would be interested to know how you can help your family members. As I said, we are very delighted to have today Mr. Curtis Lowe. Curtis is actually an accredited practicing dietitian from the Dietitians Association of Australia. He's a treasurer, media spokesperson, and a full member of the Hong Kong Dietitians Association. He holds a Bachelor of Science in Nutrition and Dietetics from the University of Newcastle in Australia, as well as a Master of Public Health in the University of Hong Kong, and a Certificate of Sports Nutrition from Sports Dietitian Australia. Curtis's career focuses on health promotion campaign among the policy level to enhance population health. He is also a part-time lecturer for us and at also other local institutes, and he teaches mostly on health promotion and nutrition. And he's actually frequently invited as a guest lecturer to deliver talks on healthy eating, knowledge sharing, cooking, and doing demonstrations. And he also has much experience in providing dietetic services to low-income families, special needs children, ethnic minorities, different age groups, and populations. He also loves to write and cook, and so he has a number of cookbooks that he's prepared. He has a cookbook for parents and children, which he published in 2021. And he's also designed interesting recipes. So actually you can hear from that he's actually very well qualified to give this talk today. So what I'm going to do now is pass the talk over to Curtis, who will deliver the talk. So thank you very much, Curtis.
Thank you, Dr. Ma. Thank you, everyone. So welcome to the sharing for today, no matter it's in person or those participants from the YouTube live. Okay, so here's Curtis, and then today I'm sharing some informations from the nutrition wise and even border wise, how the carrier can help the dementia clients to have a better quality of life. So first of all, let's have a simple memory test for everyone. So help me to memorize 3 words, which is the flower, door, and rice. So keep it in your mind, and then later on I will ask you back. Okay? And then there are 2 questions for you. The first one is, what's the food date of today? Anyone can tell me? What's the food date? June of 6th, 2026, right? And today is? Cheesecake? What cheesecake? M-A-N? Oh, okay. It's the shop, right? Okay, so today is 6th of June, 2026, and Saturday. So it's the date of today. And another question for you is, do you know where are you now? Hong Kong Youth Space, right? Okay, so it seems everyone passed this simple memory test. So if anyone can't answer these 2 questions, maybe you need some in-depth assessment. Okay, so later on I will tell you how we are going to do on it. Okay, so first of all, let's just introduce that there are different types of dementia in Hong Kong. So the very most common type is the Alzheimer's disease type, okay? So it's around 65% of the dementia cases in Hong Kong is related to with this Alzheimer's disease. There are some symptoms, for example, some memory loss, progressive deterioration, and then they have some performance about the basic activity of their daily life. So it will influence their activities, their quality of life in their when they are getting the dementia. Also, they will showing that they are empathy, and then they have some social withdrawal. So you will see that some elderly, they will have some isolation. They would like to stay at the home, unwilling to communicate with others. So there are also some behavioral disturbance if they are having the Alzheimer's disease. And for the second type, which is very related with today's topic about the stroke and the dementia, which is talking about the vascular dementia. So this one is related with around like 30% of the cases in Hong Kong. So it's a little bit lower cases. However, it's really influencing the elderly, like the quality of life. For example, they will like leading to the urinary incontinence. They will reduce their mobility. That's why they're unwilling to do exercise, unwilling to going out, and then which have the balance problem. What happens if the elderly have some balance problem? Easy to fall, okay? So once they fall, if they don't have enough like calcium, vitamin D, then they will fracture. So once they fracture, then they have to send to hospital, and then they will have some like surgery, or they have to stay a long time in hospital, and then their quality of life will be reduced, okay? So this one is very important and correlated with all the like issue with the elderly, not only talking about dementia, okay? And the next one is the mixed one. So the definition of the mixed one is like they have 2 or more active dementia. There are still different types of dementia like in Hong Kong. However, they are very like specific. Some of them relate with medication. Some of them relate with genetic. That's why we didn't talk about here today. However, if they have 2 or more active dementia types, then which will identify as the mixed dementias. Okay, and then so for example, the most common one is the Alzheimer's disease. So the first one, and then they have the vascular dementia. So if they have both of these 2 types of dementia, then we will identify it as a mixed dementia. Okay, so this a little bit introduction about what is dementia for you. So do you know what's the age? Which age group have higher like prevalence of getting dementia? Over 70? Any others ideas? Older or younger? Older, yeah, it's probably should be older, right? Okay, so here is the statistic in Hong Kong. So the data is coming from the Department of Health. So they find that based on the age group, if you are older, like in your lifespan, then you will have higher chance, higher prevalence that you will getting dementia. So you will see that like around 50%, the age group is coming from 85 years or above. So age is one of the risk factors that we can't modify. We can't do anything to prevent the dementia talking about the age. However, we still have other risk factors that we can do better to making the dementia coming out later on. Okay, but you can see that the statistics showing us that like when you get older, then you will get dementia easier. Okay, and then these 4 types of the risk factors will leading you to have the dementia, and then they are non-modifiable, so you can't do anything on it. Okay, so the first one is aging. Okay, so it's the strongest known risk factors will increasing your risk of getting the dementia. Okay, and then the second one is like about the 65 years old or above, your dementia, especially focusing on the Alzheimer's disease, will be already doubles after in like every 5 years. Okay, so that's why you see that when you are getting 70 years old, 75 years old, 85 years old, then your risk of dementia will be increasing compared with like the 65 years old one. And other one is the like family history, which is also you can't do anything on it because it's your like coming from like your parents and then your sibling. So if they are getting dementia, so statistics showing that you will have around 20% higher than the general population to get the Alzheimer's disease, which is the first type, the most common one of the dementia. And then the third one is the genetic. Okay, so but this one is quite rare. So like it's around like under age of 65 years old, but it's not common in Hong Kong. And the last one is gender. Okay, so we can see that actually compare like male and female, we find that female is easier to get dementia, and lots of other disease also higher risk like to get the disease among the females gender. Okay, so this one we can't change on it. And then some studies showing that because in the like traditionally female maybe a little bit lower education level, but surely currents like in this recent year the education level will change a lot. Okay, and then they have longer lifespan compared with male. That's why they are older. That's why they will get dementia like get more dementia than the male. And then because of the menopause, after they get the menopause, there are change of estrogen, then they also will get the dementia easier compared with the male. Okay, so these are the non-modifiable risk factor to getting dementia. Okay, so after that, let's talk something we can do. So we can modify our lifestyle. So what we can do to prevent dementia. Okay, so here are around 14 risk factors. So some of them is talking about air pollution. So we have to love our earth. We have to do some earth-friendly policy, something like that. Education, so you can study more to improve your education level. Then you can help you to prevent dementia. Okay, some other of them quite related. So I'm grouping them together. So the first one is depression and social contact. Okay, so just now we have shared, if the elderly are unwilling to contact with others, communicate with others, then they will have some mental issue. So once they get depressions, then it's quite easy for them to develop dementia issue. Okay, so what we can do with our parents or our grandpa, grandma, something like that, so we can talk more with them, communicate more with them to reduce their isolation, to reduce the risk of depression, then the dementia of the risk factor will be modified for them. And the next group is talking about head injury, hearing, and the vision issue. Why they are related? How you can collect these three risk factors? For elderly, they always can't hear things easier. They can't see the things easier. That's the issue. Why they are not rejecting to communicate with you. However, they can't hear you clearly. That's why they can't communicate with you. Okay. So once they are can't hearing, maybe they will have the isolation or depression issue, or maybe they have some medical health issue. That's why making them not listening clearly. Okay, if you didn't handle it or manage it, then it may even develop to their vision issues. And once they can't see the things clearly, then they will fall again. Once they fall, head injury, then it will increase their risk to dementia. And the next group is more related with what we can do in the lifestyle, what we can change on it: physical inactivity, drinking too much alcohol, smoking. And then cholesterol level getting too high for the bad cholesterol, and diabetes and being obesity. So it's talking about our lifestyle. If they are lack of exercise, eating unhealthily, then they will increasing their chance of getting overweight and obesity. Once they getting overweight and obesity, their cholesterol level and their diabetes risk of diabetes will be increased. That's leading to dementia. Okay, so what we can do is to change on our lifestyle. So related with our vascular risk factor, talking about the stroke and then the dementia. So the first one is the hypertension. Anyone here getting high blood pressure? Here? Yes, some of you nodding your head. Okay, so we find that if you have high blood pressure, if the doctors diagnose that you are hypertensive patients, then you will have 1.3 times higher risk to get the Alzheimer's disease, leading to dementia. Okay, because it will damaging yourself and then in your brain, and then you will reduction in the neuronal function, and then leading to self-death. Then you will causing the dementia. And the second one is the diabetes. Okay, the DM. So also the study showing that if you're getting diabetes, you will increase the risk again about the Alzheimer's disease around 46 to 56%. And then also any type of dementia is around 15 to 73%. Next one, overweight and obesity. So if your BMI, so anyone knows the BMI, the body mass index, talking about your body weight and height to identify whether you are underweight, normal, overweight, or obesity. If you're categorized into overweight and obesity range, then you have higher risk of getting dementia. And then another factors is talking about the central obesity. So you have to measure whether your weight circumference. is like more than 18 centimeters for females and 19 centimeters for the male. If you are over this range, then you will getting the central obesity. Then you also have higher chance to get the dementia. And the last one is stroke. So if you have stroke, so study showing that if you have one time, the first stroke, then you have already like 10% of them developing dementia. If you recurrence, so more than one time of getting stroke, then another like more than 1/3 of the population will have the dementia. And you have the history of stroke, so you ever have stroke before, then you also double the risk. But this one is focusing among like for the elderly who is age older than 65 years old. Then they will have double risk compared with other 65 years old healthy population. Then they will get the dementia. So everyone want to know that whether I have, or maybe my parents or some elderly, whether they have already some sign to get dementia. I want to like detect it, find it out earlier. That's why we can do the management earlier, right? We can do the intervention earlier. So here are some signs that they may have dementia, okay? So first one, they have some memory loss. They can't remember things easier. And then they can't do some justification, especially when they do some driving or when you're asking them something. So they are willing like to stay alone at home. And then probably they have some like misplacing with the language, so they can't interpret themselves as usual as before. So here are some symptoms, some signs for them that they may need some screening. It's not the diagnosis for the dementia. However, you may need to alert, increase your awareness, then maybe go with the clinic with them to do some more assessment to see whether they have dementia. So for the habits, what we can do to prevent dementia, anyone can share any tips that we can do on it? So social activities, yes. Yeah, talk more with others, or maybe going out to do some exercise, yes. Yeah, learn something new to train up their brain, right? True. Any others? Drinking coffee, yes. a little bit like related with our like nutrition angle, right? Okay. Any others? So let's see what we can do. So the first one is prevent some chronic disease, right? Just now we talked about if you get hypertension, if you get diabetes, then you will get higher chance to get dementia. So make sure that you prevent some chronic disease, okay? Second one, do more exercise, okay, to maintain your body weight. Because if you are getting like overweight and obesity, again, higher chance to get dementia. So besides exercise, what we can do while dietitian is here, eat healthier, right? So if we eat the right things, right portions, then we can control, we can manage our lifestyle to getting us like prevent overweight and obesity. So smoking and then alcohol, try not touching on this area. Sleeping is also one very important thing. You have to rest enough, okay? And lastly is your mental health. How you can stay like social active, mental health, and then collaborate with others, communicate with others is also important for you to prevent the dementia. So when we're talking about stroke and dementia, the major issue is talking about eating problems. So did you observe that if a patient, or maybe I talk about elderly first, not a dementia client, when you're observing the elderly, you can find that what eating problems they are facing now. What happened? Are they willing to eat? Or they like rejecting foods? Mm-hmm. Yeah. Mm. Yeah. Mm-hmm, mm-hmm. Yeah, true. Yeah, true. Mm-hmm. Because it's softer texture. Yeah. Okay, so later on, what happened is, if they if you observe that they like the fish, you know how to change from the beef to the fish, then you can manage the issue. However, some of us maybe don't have the idea changing from the beef to the fish. If because we know that they love beef, then we keep providing beef for them, but actually they can't eat it. Then eventually they can't get any nutrients in their body. So you can observe that maybe most of the dementia clients, they will get slimmer and slimmer, then they will get underweight. Okay, but on the other side, some of the clients, they love those junk food or sugary food, then they will keep eating because they forgot, I have already eaten. Then, oh, it's the time for me to eat again. So they keep eating and eating. Then on the other side is gaining overweight and obesity. So you can see that dementia clients, they have both sides. So you have to find out what is the underground reasons they eat or they don't want to eat. Okay, so here we can find that at the early stage, so they easily forgot to eat, to drink, or forgot whether I already eaten or not. So they may skip the meal or they may keep eating. Okay, and then their food preferences may be different as before. So maybe previously, they, for example, they like coffee, and suddenly now they change to, I love the milk tea. So it's totally different, okay? And then some of them, they may keep eating the same thing because it's their most familiar food. I don't want to try any new food. I just want what I have used to eat 10 years or 20 years ago. I just like the black sesame roll, something like that. But here, if you don't provide for me, then I won't eat anything. Okay, and then some of them maybe reduce the sensation of thirst, so they don't know they are thirsty. Even like this week, we have a very high temperature, like 30-something degrees. So if they forgot to drink, they didn't feel thirsty, then they will get dehydrated. Once they're getting dehydrated, their sensation of the taste will be reduced. Then everything they're eating, they will feel tasteless. Then they will unwilling to eat anything. Okay, they have lost their ability to shop or cook, because just now talking about elderly, no matter they have dementia or not, they have some balance issue. They have walking not properly, and they may fall. Okay, so it's already limit their shopping or cooking skills. Okay, so their choice will be limited, and they only can eat something like very similar with the previous day. Okay, and then they also feel difficult to do judgment. They can't identify whether the food is appropriate to eat or not, or is already a spoiled food. So they don't know whether should fall away or not. I have to share one experience. Even myself, last week I got a wrap. So the tortilla wrap, something like that. So I got the spinach flavor. So it's green color. Okay, so I put the room temperature. I didn't put in the fridge. So supposedly you can put 2 or 3 days because they have the preservative at there. So one day I get out, and then I start to wrap the food inside. Suddenly when I go over the wrap, then there is a mold. There is blue color. So for me, because it's quite already quite difficult for you to identify the green color tortilla wrap have a blue color a mold on the wrap. So especially for the elderly, it's quite hard for them because they have vision issue, right? So it's quite hard for them to smell, to see whether the food is appropriate to eat. So as a carer, so we have to helping them to see whether the food is appropriate or not. Okay? So later on in the middle stage, so they start eating some object as food. Okay, so it's very dangerous things. So you have to make sure that don't putting those objects similar with the food in front of them. Otherwise, they will really chew or swallowing it. They forgot how to chew it or swallowing the food. They may lost the ability to eating. Okay, forgot how to use the utensil, even the chopstick, fork or spoon. That's why we have to find out which utensil is the most familiar with them, most easiest for them to eat the food. Okay, they may spit out the food. Just now you have shared spit out the food. They don't. Yeah, they can't swallow it. Yeah, too tough, right? Yeah, and then I find that one more thing is they feel uncomfortable in their denture. Elderly, they may have some denture. If not fit their gum, then there are some space that maybe some minced meat like sticking on the like denture, they will feel uncomfortable, then they will just want to spit it out. Okay, so it's quite common, not only like for 1 or 2 elderly, but it's quite common no matter dementia clients or not. So we have to make sure that their oral hygiene, so maybe reminding them to rinse their mouth before or after they eating the foods, then it may helping them to increase their appetite, then helping them to eat more. Okay? Yeah. Mm. So previously she like cocaine. Mm, yeah. Mm. Yeah, so she's eating some object, right? Yeah, true. Okay, so this one for your case is around 2 months for this development, but the time frame you can't estimate the time frame here. So, but you can see that they are being like worse and worse than before. So this one is some just like a sign and symptom for you. Just like be careful or aware at the very beginning. So later on, they may have the middle stage, or maybe it's already very like a late stage. So that they may happening. They may eat very fast, very like slow, or maybe they finally lose of the interest of eating. Okay, that's why we have to increase our awareness. Okay, observe more with our elderly. Okay, so that's why if they are unwilling to eat or they are like keep eating, so they have imbalanced diet pattern. So if they eat a lot, then they will have increasing their bad cholesterol, or maybe like blood glucose level will increasing. So they are like getting some chronic disease, or maybe they are unwilling to eat that insufficient food intake, weight loss, or even malnutrition. Okay, if they are not eating enough, they will losing the weight or even getting sarcopenia, so losing the muscle. So if they again lose the muscle, easy to fall, then they will get fracture again. And then next one, dehydration. So just now we have shared they forgot to eat, forgot to drink. And then last one, if they getting overeat, then they will increase their body weight, getting overweight and obesity. So as a dietitian, what's our goal to helping the dementia or even the elderly? Our aim is like we don't want to limit their food choice. They need to have variety of the food choice. Okay, they can eat anything they want. Surely it should be healthy and benefit for their health. And then we have to control their portion. They should have the right amount of the food, not too much or not too small amounts. Okay. So we would like to maintain their muscle in their body, and then making them at least physical well-being, so they can still walk around, go to the park, and then go to the neighborhood, can cook, or maybe sharing food with others. And then delay their cognitive decline, so prevention of the dementia, promote the mental well-being, and then normal weight, maintain their normal weights to strengthen their immune system. So like the flu, right? If they don't have enough like nutrients to have a good immune system, it's quite easier for them to get the flu. Okay. So healthy eating really help them to reduce the risk of stroke or the others like vascular brain disease. So there are 2 diets that is quite common, like in the internet, or we have shared with others. The first one is Mediterranean diet. So I think most of you have heard about it before. So for this one, you can see that from the graphic, actually it's quite similar with our the local healthy eating food pyramid, but they highlight few things. So they still have fruit and vegetables. So I know I think all of you will eat enough fruit and vegetable, but they highlight that is the extra virgin olive oil. Highlights that we eat the rice, okay, but we eat the whole grain. Brown rice, red rice, or we choose whole grain bread, something like that, but not those simple sugar, simple carbohydrate, like white bun, something like that. Okay, they emphasize nuts and seed, fish, seafood, and then use more herbs and spices. Did you use herbs and spices during cooking? Or we will use the XO sauce, oyster sauce, soy sauce, chicken powder. They are all high in sodium, which will increasing your blood pressure. That's why these diets emphasize like natural herbs and spices and fresh food. Okay, so how it help for our brain health or even like for our like holistic health? The first one is talking about healthy fats. So they have the nut and seeds, they have the like fish and seafood. Also, they have the olive oil. They are high in omega-3, which is very important to reduce our triglyceride level, our blood pressure level, and even the inflammation. Okay, that's why helping us to prevent the vascular stroke and the vascular dementia. So the second one is the fresh food. So fresh food mostly high in potassium. And then if you reduce your like prepackaged or processed food like sausage, lunch on meat, or maybe like the Chinese dry sausage, something like that, it will reduce your sodium intake. So it can help you to prevent hypertension. Next one, high in fiber. So eat more fruit and vegetables. So the fiber help you to provide satiety, so that helping you for the weight management, and then which is good for your against your cardiovascular disease. And the last one is the antioxidant. So those fresh food, especially if you choose different color from the fruits and vegetables, they are high in antioxidant, which can help you to against those free radicals which will attack your normal cells. So eat more antioxidant from the fresh food. Okay. So the study showing that is a meta-analysis, which is like quite confidence level of the study, showing that if you follow this diet, it can help you to reduce like 10 to 30% of getting Alzheimer's disease and the dementia. Okay, so how we can apply in our daily life? At least half of your plate or maybe your meal is from the vegetables. You should use the extra virgin oil, like olive oil for the cooking, or maybe some like plant oil, instead of using those like animal fat for cooking. Anyone still using like butter, or maybe the pork, like the fatty part of the pork for cooking, or the chicken fat? Will you still using this, or maybe the elderly? Yes, they are those saturated fat, which is unhealthy for our heart and unhealthy for our body. So try to swap it to those like plant oil for the cooking. Okay, one of the choices is the olive oil, but like other types of the like plant oil is also good for you. Okay, but if you follow this diet, they will highlight is the olive oil. Okay, and then you should have some lean meat, no matter it's from the like poultry, pork, or seafood, to give you those protein. And then like 1/4 of the plate should be those carbohydrate food. It should be the beans, red beans. Yeah, so it's just one of the example for you. So you should introduce some beans, like dry beans, like soybeans, beans or red kidney beans is also a good type of protein for you. And they're also high in fiber. Yeah. So remember, use more herbs and spices for the cooking, for the seasoning. So can I drink alcohol? Just now I see from the Mediterranean diet, they have one graphic there is the red wine. Should I drink it? Yeah. Okay. So here is like why? Oh, actually, so if you have the habit, already have the habit to keep drinking the wine, so if you follow this Mediterranean diet, so you can have a small amount. Okay. So what is the like our suggestions for you not over this limit in Hong Kong? So for guys, not more than 2 standard drinks. And for ladies, not more than 1 standard drinks. So what is 1 standard drinks is around containing 10 grams of alcohol inside. So here are some examples. For example, if you're drinking 1 can of the beer, 330 mils is already 1.3 unit. So for ladies, it's already too much for you. Okay, so just now we talked about red wine. If you're drinking around 125 ml of the like red wine, it's already 1.2 unit. So you should be, as lady, you should be less than 125 ml if you choose to drink. Okay. However, if you are not alcohol drinker, you no need to get the alcohol because of following these diets. No need. Okay? So here are some like example for you. And other diets that I would like to share is the like my diet is another level of the DASH diet. I think like most of you heard about DASH diet, which is good for your heart health and then helping you to reduce the blood pressure. But this one, my diet, is combine the Mediterranean diet with the DASH diet. Okay, so for this one, they have 15 components for you to follow. Okay, so 10 of them is what you should do, and 5 of them you should limit to do. Okay, so it's quite similar with before, encouraging you to eat whole grain. Okay, at least you have 1 serving of the green leaf and another 1 type of vegetables with other colors. So you should have 2 different colors in 1 day of the vegetables. Anyone did it? Or everything is about green? Yeah, so if everything is just green color, so next time, maybe later on, you should buy some other colors of vegetables to enhance your plate. For example, tomato, or maybe capsicum is already 3 colors. Like the red pepper, yellow pepper, and the green pepper is already 3 colors, okay? And then they highlight that is the berries. You should eat the berries at least twice a week. So blueberries, strawberries is the season of blueberries. I just got some this morning. Okay, so it's very like high in the antioxidant. For this one, if you follow the MIND diet, so they didn't highlight the portion, but the frequency only. So you should eat like twice a week. However, if you combine with the like local standard, you should eat 2 serves of fruits per day. So around half bowl is equal to 1 serve. So you should have 1 bowl if you follow this one. So 1 week you have 2 days to have 1 bowl of berries. Yeah, you can mix different kind of the berries. Okay, so you should eat nuts, fish, and then here is also encourage you to eat some like legumes and the beans. So like in local diets, like in Hong Kong, we seldom eat beans. Except the tofu, right? Even the tofu you won't cook like quite frequent, right? So like in Western, you can see that they always introduce some beans or legumes in their diets, okay? Because they are high in fiber compared with those meats, okay? And then, yep. What he said, yeah? Yeah, 6 pieces of almond, yeah. Oh, so for here, yes, 1 serving is around like 1 handful, around 28 to 30 grams of the nuts. So here we would recommend plain nuts. So unsalted, like not defined, not sweetened one. And then the portion is around like 28 to 30 grams. So it depends what type of nuts you're eating. So macadamia, maybe you have to eat like smaller amounts because they are larger, heavier. Okay, so it doesn't matter which type of nuts you are eating, but for me, should be the plain one, then it should be fine. And then because nuts are high in fat, so you have to balance in your whole day fat intake. So if you keep eating a large amount of the fats from the nuts, then you will gain weight. Yeah, but for elderly, if they are losing weight, then this one is a good option for them to get some healthy fats. However, on the other side, it's quite hard for them to chew and swallow. So you have to think about how to like combine in your normal diets. Yeah, it's also good fat. So you can introduce it here. For it will be in between vegetables and the healthy fats one. So you can a little bit like of the fat can cut off from the nuts. But if you really follow the MIND diet, then you should follow all of these 15 recommendations for you. Yeah. So, but if you are not talking about following the MIND diet, I just like a healthy diet, then avocado, they can give you the healthy fat and the fiber, so you can cut off some fat intake in your diet. Yeah. And then for those like 5 limitations, so it's recommend you to reduce the like a saturated fat from the meats. Okay, so the beef, the pork, you should reduce to like less than 4 times a week. Not limiting like not eating anymore, but you should reduce the red meat intake, the frequency of red meat intake, and then reduce the like a saturated fat intake from the fat, from the butter, or from the like a deep fried food. Okay, so here are some highlights of the MIND diet. So how they can helping you? Again, they emphasize the green leafy vegetables. So they are high in folate, vitamin E, carotenoid, and flavonoid, which is helping you to reduce the risk of dementia. So dietary intake from the berries, just now is talking about the berries. Why so important? Again, antioxidant, anti-inflammatory properties. So which can maintain you have the good self, good brain self. Okay? Next one is the fish. Okay, fish consumption because they have some omega-3 for you again. And then the last one is the limited unhealthy fats. But in Hong Kong, it's quite common for us to get those unhealthy fats. For example, when you go to Cha Chan Tan, you have the what you will have for the breakfast. Lunch on meat, 2 sun-side egg, sausage, instant noodles. So all of them are unhealthy fats for us. Okay, so you have to swap like in your daily life to get a healthier diet. So underweight and unintentional weight loss. So here we have to highlight this unintentional weight loss. It's not talking about, oh, I'm getting overweight or obesity, I have to lose weight. Here, I don't want to lose weight, but I don't know why I'm keep like losing my weight. So what is quite common in elderly? So what we should do, especially for those with dementia. The first one, it may be causing by the texture. I can't chew it. It's too hard texture. I can't swallow it. So what we have to do to solve the problem, food texture modification. So maybe we have to like dice it, slice it, or maybe mince it. Or in some worst case, we have to puree it, to brand it. Okay? So this one we have to like cross over with speech pathologists, so they will assess their swallowing ability or their chewing ability, so that we can have the best the texture modification food for our patient. And the next one is quite important for a dietitian to do on it. So they can't eat a large amount of food at us. Okay, so they have a small stomach. They always can't remember that I have to eat. So we have to do some food fortification. We have to enrich the food, enrich the meal for them. We have to make every mouth meaningful. Don't waste their appetite. Okay? So small frequent meal and then providing them some finger food, small finger food. Okay? And the last one is, remember, if they have some sports food, take away. It's talking about safety. Don't eat those unsafety food. Okay? So for the food fortification, so we can add some extra nutrients for them. So it's like especially for those who have poor appetite, and that the benefit is helping them to get more nutrients, improve their immune system, and then they can recovery easier. It's quite common that we will use the milk powder, cheese, or maybe some avocado to enrich their food intake. So we can try to add some milk powder in their drinks or their oatmeal. We can spread some like mashed avocado or pure peanut butter on their bread. Then once they eat, they can have the carbohydrate from the bread, and they also can have the good fat from the avocado and the peanut butter. So any ideas what we can do? For example, I use the egg and tofu to make a steamed egg. So you may use the water to like making the steamed egg, right? However, I will try to use some milk or soy milk to replace the water. So make it more nutrients in the same place of the steamed egg. So I can make it like higher protein, higher calcium intake. So if I'm providing some like drinks for them, for example, having a skim milk for them, so I will add some sesame powder to increase their good fat. Okay. If I'm making the soup, so in Asian country we always make soup. However, if you are not eating the ingredients in the soup, you can't get the protein, you can't get the fiber from that. Okay. So what we should do, brand it to make it a little bit like Western style. So every time they drink the soup, they will also eat the meat and the fiber like from the vegetables and from getting the protein from there. Black sesame seed. Black sesame seed, yeah. Yes, but they also high in fiber. Maybe they will easily to get like food easier. But and then they also can't chew it, because they still have the like the seed there. But if you brand it like very smoothly, easier for them like to chew and to swallow. Yeah, it's just one of the example. You can brainstorm more like if you know the theory behind. Okay, so remember that when we're doing the nutrition management, we have to like make sure that it's individualized. There is no one meal fit for everyone. Just now what I've shared is also not fit for everyone. You have to tailor-make it. That's why dietitian is helping you on it. So you have to manage their swallowing issue to prevent dysphagia. So you have to contact with the speech pathologist. And then you have to addressing their malnutrition and hydration issue. So we will do some assessment to see whether they are on the stage of like malnutrition. And then we may use some oral supplement if they need to. So here are some common like type of like oral nutrition that we may provide for our clients. So some of them are basic formula. So it's very little calorie providing for them. It's good to serve it as a snack. So some of them is some like booster. So we'll add some olive oil, add some like sesame powder, or maybe add some like protein powder for them. Depends what they need. And then we have some high protein, high energy supplement. So it's quite creamy. They are like very thick texture. Some of the elderly dislike it because it was gelling their mouth, okay? But they are very like, it's a good replacement if they can't eat the meal. Then they can just drink a little bottle, then I can fulfill all the like nutrient needs in that meal. And some of them are specialized like formula, so specific like for diabetes, renal disease, or some like cancer patient. So it really depends what other comorbidity they have besides dementia. So for carer, so we have to make sure about the food texture, whether the shape and the portion is good enough for them, how to prepare the meal like in a very convenient style, food hygiene, and how to maintain the appetite. So this one is talking about food texture. Be careful, those small, hard, chewy, or maybe crumbly food, because it's very easy for them to get choking. Okay, and then do not like put too much of food in their mouth at one time. They need some time for chewing to cut it small pieces. And then the environment, make sure that it's well lit, tidy, and a quiet environment. Okay, so not too much distraction for them. Not watching the TV, not reading the like newspaper, and then make sure that if they need to wear the glasses, wearing it when they eating, and the denture. Don't forget the denture, otherwise they can't chew it like properly. And then when you're preparing the meal, so we have to make sure that grains food, we should include it. Try to make it whole grain one, depends their chewing issue, their chewing ability, okay? We have meat and alternative. If they can't eat those tough, like beef, something like that, you can swap it egg, tofu, or soft boiled like egg or beans for them. And remember, vegetables, different color vegetables, okay? Making it like more colorful, increase their appetite, then increase their chance to eat more. Hygiene is very important for you. I have a rule for you, it's 3-2-1. What is 3-2-1? Make sure that if you cook the food, put in the fridge, you can't keep it more than 3 days. Even you didn't touch on it after you put in the fridge. After 3 days, you have to throw it away. You know, elderly, they always want to keep everything in the fridge and keep like forever for them. Yeah, cannot. Okay, the maximum 3 days. 2, what is 2 is, after you cooking, within 2 hours, you should put it into the fridge. Otherwise, some bacteria there, then it will get growing up, okay? And finally, 1, what is 1 is, once you get it out from the fridge, you only can reheat it 1 time. If you can't finish this time, don't put it back to the fridge. You have to throw it away already. So if you get it out, so get the appropriate amount. Don't cook everything at a large pot, okay? And then for hot food, higher than 60 degrees, and for the cold food, lower than 4 degrees to make sure the correct temperature for them. Okay, how to increase their appetite? So make sure they have a good instruction. Tell them how to eat appropriately because they may forget how to chew, how to swallow, how to use the spoon. You should sitting in front of them, demonstrate them how to use the chopstick, how to use the spoon. No need to help them until they need it. Okay, so don't like rely on it forever. Okay. So you can see that like dementia is not talking about nutrition only. There are lots of other area health can help you. Social workers, how you can do the food preparation, how you can buy the food from the supermarket or the wet market. Occupational therapists, how to do the assessment to see whether they are getting like dementia or how can train up their brain. And also speech pathologists for about chewing and swallowing ability. So community, there are lots of different campaigns from the government, different like NGO, they are working something, helping on the dementia clients. So these are those resources that we can find out from the like medical social is very important collaboration. So for dietitian, what we are going to do, we will like assess their body like status, whether they have malnutrition or not. We will read their laboratory tests to see whether their blood test is like in a normal level or not. And then we will discuss together. We are not giving you a meal plan. We are discussing together how can modify your like lifestyle. And finally, we will teach you how to work on it based on your need, based on your habit. Okay, so don't suppose that a dietitian will give you like meal plan, like writing everything for you, for everyone. There is no one fit menu for everyone. So like in the conclusion, so here 6 pillars for you, very important. The first one, time need screening. So you have to identify whether they have this type of issue or not. Then if they have this sign, go to the clinical assessment. You need the doctors, you need the occupational therapists have an in-depth assessment for you to diagnose dementia. Then we have targeted intervention. You are malnutrition or you are overweight, you have issue of chewing or swallowing, then we have to collaborate with some allied health. Carer empowerment, you have to know how to helping the dementia clients, multidisciplinary client, not only dietitian, not only doctors, we have other like health professionals helping you. And the community activation. Find the resources, use the resources from the community so you can learn more from them, okay? So finally, about dementia, not just one everything on your plate. It's continuous empathetic actions. It's a chain, okay? Not only one thing. It's about related with all different like factors. We have to work it collaboratively, and then we need the support from the community, okay? So that's the end of today. I have one more question for you. So do you remember the 3 words at the beginning? Yes, that's good. So it seems that all of you passed the simple like memory test. If you can't remember it, it's because it's simple memory test, okay? If you can't memorize it, so you may need some like further assessment. Yeah, you can try it with some elderly. They may can't remember it. Oh, some further assessment is talking about like MOCA. So the, MOCA is M-O-C-A. So it's talking about like it's a full assessment that the doctors or maybe the occupation therapists will help you to do the assessment. Okay, so that's the end of my sharing today. So happy that the information can help you in the future.
Okay, so thank you very. Okay, thank you very much for such an interesting talk. I think you'll all agree. I think we just have time for maybe just one quick question before we close. So does anybody have any questions in the room? Yes?
Only eat 1 meal.
Okay. Okay, so the question was her daughter only eats 1 meal a day. Is that healthy? Is she have Alzheimer's, stroke, any of these conditions? Nothing? Okay, so actually just from a healthy point of view, that's not really on the topic. Depends on what she eats. So I think that will be a difficult question to answer in just a few minutes, so we can talk about that later. Okay, all right, so I'd like to thank everybody for joining, for those people who are online, but also to the people into the room. Before we actually end, I'd like to present a little gift to Curtis.